All right, everyone. Good afternoon, everybody, and welcome to our webinar on the Health Data Stewardship Framework. My name's Maureen Kelly, and I'm the Director of the Health Data Stewardship Initiative at CIHI, and I'll be your MC for this session. It's my pleasure to welcome you to our second webinar in this series that will focus on health data stewardship, and we'll be doing a deep dive into the framework itself and its foundational components and how they'll be working to improve how health data is accessed, used, and shared across Canada. As people are settling in, there are a few housekeeping items to mention. This webinar is available in both English and French. So if you need to listen in on French, click on the globe icon. And if you can't see it right away, select more on the menu bar below, and you should be able to find it, the globe icon, and then you can select the French interpretation. Also, we have closed captioning available. So similarly, you can select the show captions at the bottom of your screen. The webinar is being recorded, and we will be sending a link out to the recording. Should be emailed to you when it's available within about a week. If you've got trouble hearing, adjust your audio settings and you can press the up arrow next to the microphone icon. When you joined this session, you were automatically muted, but we would really, that doesn't mean to say that you can't answer still ask questions, and we really want to have this session to be interactive, and we have set aside some time at the end of after the presentations to have a Q&A session. So if you you can ask a question or leave a comment through the Q&A, which again should be at the bottom of your screen. Okay. So before we begin, I'd like us all to take a moment to reflect on the lands that we are calling in from. I'm calling in from Ottawa, which is built on the traditional unceded territory of the Anishinaabe Algonquin Nation. At CIHI, we acknowledge and respect the lands on which our offices are located and recognize that these lands are home to many diverse First Nations, Inuit, and Métis people. We also recognize the responsibility that comes with being a pan-Canadian steward of health data and the role we play in supporting systems that have historically excluded or misrepresented Indigenous peoples. We're committed to the work and reconciliation of advancing cultural safety and humility in health systems. This starts with learning and unlearning so we can co-create relationships with First Nations, Inuit, Métis rights holders, uphold data sovereignty, and transform data for shared wellness. So the objectives today for this session are, and hopefully things that you'll take away, is understand what health data stewardship is and why it's so important to the health system and health system data. Learn more about the health data stewardship framework itself and its foundational components, and how they can be used to create the right conditions for how data access is used and shared. Learn how CIHI is catalyzing health data stewardship through a pan-Canadian governance model and driver projects, and hear about what's coming up next for our initiative. And if you can go to the next slide, Jessie. Oh. And today we have two key members of our Health Data Stewardship Initiative team to walk through some of the content. First up, we have Jessie Fracassi, who's our program lead. She'll provide the detailed introduction of the stewardship framework. And then we'll have Toby Henderson, the program manager, who will speak more about the governance model and the driver projects. After the presentations, as I mentioned, I'll be back to moderate our Q&A session. So please feel free to enter the questions as we go. And with that, I will hand things over to Jessie. Jessie?
Great, thank you, Maureen. It is a pleasure to be here today. So as Maureen mentioned, I will be diving into the Health Data Stewardship Framework today. But before I do, I wanted to set the stage a little bit. So let's look at this image of a road network here. Now, imagine that these roads didn't connect. Imagine that on some roads, cars drive on the right. On others, they drive on the left. On some, we only allow motorcycles and transport trucks. On others, we allow cars, but not red ones. Some are publicly owned, so they are visible on a map. Others are privately owned, and we can't see them on a map at all. Now, imagine being a driver who has to navigate all of this. Actually, you don't have to imagine because you are the driver. But of course, I'm not talking about roads. I'm talking about Canada's health data, the rules of engagement around how it's organized, shared, and used for public benefit. I'm talking about health data stewardship, about building the foundation for responsible data use and unlocking the power of data to get it to where it needs to go. So why is this important? Well, better access to health data benefits everyone in the system. Patients and families benefit from timely access to their own information and from data being used safely to improve care and outcomes. Clinicians and health providers benefit from having the right information at the right time to support safe, effective decision-making. Health system leaders and public health organizations rely on timely, high-quality data to manage systems, respond to emerging risks, and improve population health. Researchers and innovators benefit from secure, responsible access to data that enables discovery, innovation, and learning health systems. So where does data stewardship fit in? Let's go back to that traffic analogy for a second. Why do our roads work? Well, we have consistent traffic rules that really work for different kinds of vehicles, and we have ways to enforce those rules. We teach people how to drive and license our drivers and expect them to use the roads safely, no matter where in Canada they drive. We also have rules and requirements relating to vehicles they drive to make sure that they are safe and fit to drive. And we have maps so drivers know where they're going and how to get there. Today, this system enables Canadians to get where they're going and for consumer goods to move. But it's also the blueprint for the future. We will not be reinventing the roads and the rules that govern them to accommodate self-driving cars. No, we're going to expect self-driving cars to use the existing roads with existing rules. Data stewardship is similar. The focus is on the rules and the organizational and human factors that are needed to make the system work. Of course, it's not quite that straightforward. We have a very challenging health system. Actually, it's not just one health system, it's many health systems, each with their own data, rules, tools, and priorities. This results in poorer outcomes and quality of care for Canadians due to fragmented data and systems, lost productivity, slow innovation, and increased costs. These underlying challenges are not technical challenges. They are related to the organizational, governance, and human factors. So what do we need to do? Well, we need to make access to data easier, and that includes access for researchers so Canadians don't miss out on innovations that will improve their healthcare and their health. But we need to ensure that we're doing this safely and responsibly and really build and maintain public trust in how data is shared and used. We need to improve efficiency through alignment and better coordination, both within and across jurisdictions. And we need to make sure that the jurisdictional needs and priorities are well supported. So CIHI has been leading the work to address those challenges and to create the conditions for safe, ethical, and effective data sharing and use within each health system and across them. In fact, this past fall, we've received full support and endorsement from the Conference of Deputy Ministers of Health to continue to lead this important health data stewardship initiative on behalf of our partners across Canada. We are therefore now moving from vision into action. So we're focused on advancing sort of 4 key buckets of work to support the implementation and the scaling of data stewardship across the country. So our first bucket is around engagement. And this is around ensuring that public trust and engagement is really embedded in the work through diverse stakeholder, patient, and community engagement. So this will ensure that how data is shared and used really reflects public values, needs, and expectations in a meaningful way. The next bucket is around the framework and resources. And this is really around sort of driving that collective progress by providing common frameworks, standards, and tools, and supporting jurisdictions where they are, and enabling effective and efficient decision-making and data operations. The next bucket is the governance and action plan. And this one is around coordinating a coherent pan-Canadian picture of the health system that provides trusted, comparable insights to guide policy, fuel innovation, and address pressing challenges. Its focus is on convening provinces and territories and other interest holders to achieve agreement and advancement on issues of national importance. Our last bucket is the driver projects. So this is around turning data stewardship into action through collaborative initiatives and repeatable approaches. The driver projects really show real-world implementation and scaling of stewardship practices. So this is really a nationwide initiative. It's not about changing how CIHI captures, uses, or shares health data. It's about supporting a new era, one where trusted data stewardship fuels better care, smarter policy, and more equitable health outcomes for everyone in Canada. So in order to do this, it was imperative that we embarked on this journey collaboratively. So CIHI spoke with a wide variety of health system stakeholders, including health data organizations, First Nations, Inuit, and Métis organizations, provinces and territories, patients, and the public. We held monthly meetings with 2 external advisory groups, one who was focused more on the jurisdictional perspectives and the other on subject matter expertise from across the nation. We held over 230 stakeholder engagements, conducted focus groups with patient partners, and hosted lively and engaging forums with stakeholders across the country. The outcomes of all of these engagement sessions directly impacted the deliverables for this initiative. It not only helps to better inform the work, but it helps to build trust and ensures that decisions are made in tune with the needs and the expectations of the public and our stakeholders to provide that public benefit. As this work continues, so will our engagements, consultations, and our commitment to keeping our stakeholders at the core of decisions about how data is accessed, used, and shared. So at this point, I've talked quite a bit about health data stewardship, but I haven't actually defined it. So at its core, data stewardship is the responsibility to take care of data for public and individual benefit, both now and for the future. Health data stewardship helps advance the policies, practices, legislation, and the culture needed to improve data capture, sharing, and use, so that it's safe, ethical, transparent, and trustworthy, and that it has a focus on public benefit, quality, interoperability, and respect for Indigenous data sovereignty and patient rights. Data stewardship also has strategic and operational aspects to it. The strategic aspects are really focused on changing the overall environment and conditions of data use. And the operational aspects really ensure that sort of day-to-day handling of data is safe, ethical, and transparent. So to further support good stewardship practices and to ensure that we are putting people and communities at the core of decisions, we took what we heard in our many engagement sessions and developed these hallmarks of good health data stewardship. These hallmarks have been defined to help drive necessary changes in jurisdictional policy, practice, legislation, and culture in regard to health data access, sharing, and use, and to really help motivate clinicians, administrators, innovators to be proactive in seeking new uses of data by taking well-balanced risks to unlock its significant value for individuals, healthcare providers, and the economy. The hallmarks center around 4 main topics: making quality data accessible and usable for those who need it, safeguarding data against misuse, advancing and adhering to relevant laws, policies, and ethical standards, and being transparent about how data is used and shared. I won't go into all the detail here, but I will encourage you to check out the web pages on cihi.ca to read through the hallmarks in more detail. So now let's talk about the framework itself in a little bit more detail. The goal of the framework is to take a holistic approach to data stewardship bringing together the foundational components needed to create the right conditions for how health data is accessed, used, and shared. It's really meant to guide and support users so that they can move forward with a stewardship approach to data collection, access, and use. It's meant to support and augment, not to replace, established processes, strategies, and programs of work. Users are to work towards implementing aspects of the framework however they can within initiatives already underway. So with examples of tangible ways of enabling change, the framework can be used to begin or advance health data stewardship journeys. At its core, the framework supports safe, ethical, and essential access to health data for public benefit, while increasing clarity and support for everyone who has responsibilities across the health data lifecycle. So I wanted to take a quick minute to talk about the development process as well, as it was an important part of the story. The framework was really grounded in the Pan-Canadian Health Data Charter, and as I mentioned, informed by extensive engagement with many different stakeholders. There were check-ins with several federal, provincial, and territorial tables, including the Conference of Deputy Ministers of Health, which, as I mentioned earlier, ultimately resulted in the full support and endorsement of this work. So CIHI also took, excuse me, an action-oriented sort of use case approach to sort of testing and refining the framework against real-world challenges to ensure that it could be applied in practice and not just in theory. So the result of all of this is a framework that really reflects shared values, real system needs, and a collective commitment to advancing health data stewardship across Canada. So here's the framework itself, kind of in a nutshell. I like to call this our placemat slide. So before I go into any more detail on the specific components, I want to highlight a couple of things. So first, you can see the first 7 components kind of sit along a continuum from strategic stewardship to operational stewardship, starting with the guiding principles and culture, moving all the way through to data use. The final 2 components, the First Nations, Inuit, and Métis data governance and sovereignty, and the public trust and engagement components, intentionally span the entire framework. They are not standalone considerations. They must be embedded across every aspect of stewardship. The components themselves are also interdependent. Progress in one area really depends on progress in others. For example, strong data management without clear governance or public trust will not enable meaningful data sharing. Also important to note is that the framework is technologically independent. It focuses on the human, policy, and governance foundations that must be in place for those technical solutions to succeed. In terms of the components themselves, first we have the guiding principles and culture. This component is about the guiding rules that provide a strong foundation to help inform decisions and steer actions in a rapidly evolving health data landscape. It provides a cultural shift towards data being shared securely and appropriately for individual care and for public benefit. Next up, we have the legislation, regulations, and agreements. So this one is about evolving the legislation, regulations, and agreements to advance consistency in approaches and understanding. And it's about supporting clear, consistent, and relevant legislation that works to reduce barriers associated with data sharing. The next component is data strategy. And this is really about identifying shared data requirements for health system priorities through a comprehensive plan that outlines how health data will be collected, shared, and used to achieve a common vision, shared objectives, and shared goals. Next up is data governance, and this is really around the formalization and the enforcement of structures, processes, and rules that guide decisions about data, aiming to establish consistency in data-related activities. Stewardship skills and literacy is the next component, and this one is about providing the supports and resources to help decision makers, stewards, and all of those people who are using the data to really understand the policies, the standards, the processes, and the tools, and ensure that they are fully equipped to perform in their roles. Next, we have data management. This is around the collection, storage, and sharing of data in fair, safe, and efficient ways through several subdisciplines. These subdisciplines include things like data standards, data quality, interoperability, data architecture. The next component is data use, and this is around ensuring the data is fit for purpose for all approved uses, including primary use and the reuse of data. Next, we have First Nations, Inuit, Métis, and data governance and sovereignty. And this component helps ground the work in cultural safety and humility, and it supports building respectful, meaningful relationships. This component is about working to ensure that First Nations, Inuit, and Métis peoples are engaged through their own representative institutions and are able to determine their needs and preferences in how their respective data will be governed. Last, but certainly not least, we have public trust and engagement. So this component is around ensuring that the rules, the policies, and the procedures are in tune with the needs of the public in order to provide that public benefit. So within the framework itself, each of those 9 components has 2 accompanying information cards. So I've included the cards for the stewardship skills and literacy component as an example, but similar cards exist for each one of the components. So in this card, you're going to find the component overviews and impacts, listings of key elements required to successfully implement the component, examples that exist across the country that can help inform and guide component advancement, and examples of some of the sort of bigger barriers or problems that are associated with each of the stewardship components. On the second card, you'll find key actions to be taken to enable change and ultimately lead to successful implementation of health data stewardship approaches. The actions are categorized according to type of action required. So actions related to structure, rules, resources, and people. So for example, the structure actions deal with the strategy, governance, and decision-making that provide overall direction, accountability, and oversight. The rule-based actions focus on the rules needed to appropriately capture, process, analyze, and use the health data. The resource actions deal with the various types of resources that are needed for implementation. So things like standards, assets, and other tools. And lastly, the people actions, and these are focused on all sort of the people involved in the data stewardship and the knowledge and support needed to empower them to take a stewardship approach. So the health data stewardship framework provides that sort of needed structure and guidance to create the conditions for safe, ethical, and effective data sharing and use of health data. However, it does not stand alone. There are additional frameworks that exist that really help build out these necessary components. So here we have a non-exhaustive overview of some key frameworks that sort of help round out different aspects of the framework. We know there are a lot of frameworks out there already, and CIHI has more than our fair share of them. So we've kind of grouped them here to show how, at least some of them, how they relate back up to stewardship. So for example, we have frameworks such as CIHI's health data ethics framework, which sort of acts as a values compass. It sets the should we do this guardrail. We've also got CIHI's privacy and security framework, which falls into the sort of protection pillar, which looks at the can we do this and under what conditions can we do this guardrail. We've got CIHI's health data and information governance capability framework, which falls into that sort of operational backbone category. And that looks at sort of how decisions are being made. So those are just a few of the examples, but together these frameworks, which I will not go into any more detail on for now, really form a layered ecosystem of governance, ethics, standards, capabilities, protection, innovation, with the data stewardship framework serving as that bridge that really connects them all. So given that, I'm going to pass things over to Toby now to speak a little bit on how CIHI is catalyzing health data stewardship through pan-Canadian governance model and speak a little bit on our driver projects. Toby, over to you.
Great. Thank you, Jessie. And I did see the note in the comments to not go too quickly so that the simultaneous interpretation can keep up. All right, so I'm going to talk a little bit about, I think I'm going to expand a little bit on sort of that Team Canada approach that Jessie already mentioned, recognizing the need for that consistent, inclusive, and ethically grounded approach to health data stewardship. We've been working alongside the provinces and territories, First Nations, Inuit, and Métis organizations, and other partners to shape a collaborative way forward. So one that is attempts to build public trust and reflect back those shared values, and of course respects the unique needs of jurisdictions, data users, and First Nation, Inuit, and Métis peoples. So we're really taking that Team Canada approach to providing and supporting a wide range of governance functions. And this includes things like strategy, coordination and connection, gathering input and advice and information sharing, decision-making, and oversight and monitoring. So talking a little bit about the governance model now, we're implementing a new functions-based approach to data stewardship governance for Canada. So this structure enables coordination, transparency, and accountability without creating unnecessary burden. So that was a key consideration for us. How does this fit within the current structures that exist already, and how can we leverage those? So our governance and collaboration model essentially sets out our ways of working together so that we can be effective and have more shared but coordinated accountability. Essentially, we're creating 4 new groups that will report up to 2 existing FPT governance committees, and these are the Public Health Data Steering Committee and the Digital Health and Health Data Priorities Table, and both of these tables have accountability for executing on the joint FPT action plan. So first, CIHI will be leading what we're calling the Data Stewardship Strategic Coordinating Center, and this group will essentially act as the national nerve center for data stewardship. So it's meant to coordinate a coherent pan-Canadian picture of the health system that provides trusted, comparable insights to guide policy, fuel innovation, and address pressing challenges. And it will convene the provinces and territories and other key interest holders to help achieve this agreement and advancement on issues of national importance. The Data Stewardship Collaborative within this coordinating center will serve as the key forum for building consensus and recommendations and advancing solutions that span across jurisdictions and sectors. So very critical for that alignment piece. The other box within this is the multi-interest advisory panel. So this panel is meant to bring together that diverse cross-sector voice to data stewardship to help shape priorities and provide equity-centered advice. So this panel will include representation from the public, patients, clinicians, different community groups, First Nations, Inuit, and Métis members, researchers, and the list goes on. And then lastly, within this coordinating center, we have what we are calling and envisioning task and finish groups. So these are intended to be time-limited, expert-driven teams, tiger teams, if you will, that are convened to develop recommendations, frameworks, or other solutions for priority topics. So they will have a very specific strategic output or deliverable attached to them. So just to summarize, the framework and the governance structures together are what will really help support the establishment of a common agreed upon agenda for the country when it comes to stewardship. They'll provide that needed foundation for collaboration and change, and they'll help fuel better care, smarter policy, and more equitable health outcomes for everybody in Canada. Talking a little bit more about the common agenda, it will be one of the first orders of business for the Data Stewardship Collaborative. So we're convening the first instance of that meeting in early March. And as mentioned earlier, 2 of the priorities for this collaborative will be to agree on a prioritized set of challenges and to set a forward-looking agenda or action plan. So essentially, the challenge list, which we've been referring to throughout this webinar, is an ever-evolving pan-Canadian list of data stewardship challenges that we've gathered through the extensive engagement that we've done through the consultation with health system stakeholders, again, which includes patients and the public. So some example challenges include, and the list is very long, and they kind of exist at different levels of detail. But one good example is some of the legislative inconsistencies that we face across jurisdictions that inhibit the data sharing that we'd like to see. We know that there is issues with public trust in certain instances and a deficit there that needs to be overcome. And then on the data side, there's data availability challenges. So for example, challenges in having more timely hospital data and some gaps in accessing data related to primary care are a couple of examples of those. So this challenge list is meant to support and contribute to the creation of that joint action plan. And the action plan itself is meant to serve as a roadmap for the collective efforts to identify priorities, challenges, and solutions across jurisdictions. So it's meant to guide the implementation and advancement of health data stewardship over time. So really taking that action-oriented approach, Jesse referred to our driver projects earlier, and making incremental progress. So speaking of those driver projects, to provide a few examples, the framework and the governance model really lay the foundations for data stewardship, but these projects are what we are helping to put data stewardship into action. So we're now focused on practical applications together with jurisdictions and other key partners to help solve some of those collective challenges that we're talking about. So we do have some initial driver projects, as we call them, that have started to implement the framework for specific use cases. And the idea is that this will provide insights to advance a stewardship approach on a broader scale. So here's a list of some of those priority challenges that we will be tackling. And we do expect that as we start to develop that joint action plan and broaden the agenda, that this list of driver projects will grow. On the research and innovation front, as part of our multi-pronged approach to support data for research, innovation, and especially how we can responsibly use it for AI at scale, we're working with the Health Data Research Network to support data custodians and data stewards in assessing risks and benefits of data access requests in a more comprehensive and efficient way. So that's just one example there. And then we have two driver projects that are focused on supporting interoperability. And this is a key element of the FPT Joint Action Plan. So one is focused on immunization data, where we're working to support an initiative that's already underway with the Public Health Agency of Canada called their Interoperability Immunization Data Initiative. And the idea here is to improve the sharing of immunization data focused on helping to work through the governance challenges. So what are the human and organizational factors that we need to address from a stewardship perspective? And the goal is to help develop actionable recommendations on those fronts to improve access to quality immunization data and to better connect Canadian immunization data and registries. The second, sort of on the interoperability front, relates to the patient summary. So here we're working with our colleagues at Canada Health InfoWay, and it's really focused on supporting the stewardship of the data that will flow through the patient summary solutions. So in addition to supporting the needed data content, we're also focusing on how patients could possibly be able to correct mistakes that they may find in their records, which is a big concern that we heard from them when we were doing our engagement with them in our focus groups. Also looking at how to effectively manage issues found when data is brought together from different systems. So just reiterating here that we're focused on the data content and the related quality. So things like the comparability, reliability, accuracy, and how this fits in with the broader Pan-Canadian Health Data Content Framework Standards piece. That's a critical part of the Connected Care initiative that CIHI is working on and part of the interoperability roadmap. And so not necessarily focusing on the technical exchange components. Another example here is work that Health PEI has taken on. So we're providing support to them to embed data stewardship into the creation of a health data roadmap, which is meant to sort of optimize and improve their use of data and analytics for the management of the health system there. And then on the privacy legislation front, particularly relevant with the reintroduction of the Connected Care for Canadians Act, we're working on this front to do legislative scans, creating tools to support the understanding and consistent interpretation of legislation, ultimately to support improved data sharing. So there's an ongoing stream of work to provide coordinated input on this front. So talking a little bit about what's next here, which is our implementation hub that we're very excited about. And a big focus of the upcoming year is on the creation of this hub, which will be an evolving collection of resources, documents, and tools that are designed to support implementation of the framework. So it is expected that this hub will grow and evolve over time. But at the moment, we are planning on releasing 3 initial resources this spring. So the first is a data stewardship self-assessment tool. So this would be a practical tool to help organizations assess their current practices, identify strengths and gaps, and help to prioritize actions across each of the 9 foundational components of the Health Data Stewardship Framework. The second tool is a glossary. So this is meant to support common understanding and consistent use of key stewardship-related terms and concepts. And the third is an inventory of resources. So this inventory brings together a curated collection of national and international data stewardship resources that support pan-Canadian data access, sharing, and use. So it'll contain links to relevant tools, frameworks, guidance, and examples to help reduce duplication, break down some of those silos, and enable that cross-jurisdictional learning and sharing. So this is the Health Data Stewardship Initiative in a nutshell. There's lots of additional information on CIHI's website, so I do encourage you to go there to take a little bit more of a deeper dive. But at this point, I will pass things back over to Maureen so that we can sort of move into the Q&A session part of the presentation.
All right, thank you, Toby and Jessie. And we've already got some questions in the chat, but I would in the Q&A. So please, if you've got other questions or comments, please feel free to enter them. But I will maybe start at the top. First was just a comment about the roads analogy, which I do think is a great one for and how we've been using it. So thanks for that. The first question is, who is the framework for? Is it just meant to be used at the provincial territorial level or for a specific sector, e.g. hospital data? So maybe I'll pass that over to Jessie first.
Great, thank you. Yeah, that's a great question and something we definitely want to be very clear about. So the framework and the other resources that are stemming from this initiative have been developed to support anyone who touches, uses, or has responsibilities related to health information at any point throughout the health data lifecycle and kind of for all purposes. So of course that includes the jurisdictions, so provincial, territorial, federal organizations, First Nations, Inuit, and Métis organizations. It also includes all types of organizations that are responsible for any type of health data kind of across any domain. So that includes hospital, long-term care, health workforce, pharmaceutical data, the list kind of goes on. It also includes sort of anyone who is using health data for clinical care, so healthcare providers, allied health professionals, patients wanting to access their own health data. It includes purposes such as public health, health system management, performance reporting, research and innovation. So AI stuff gets in there as well. So it really does, this framework and this initiative in general really does have a really wide breadth of users.
Toby, anything else to add on that one?
I think Jessie did a pretty good job of covering it. So just reiterating that whole data lifecycle approach. So really anybody who touches the data is considered a steward in some way in our eyes.
All right, so maybe I will throw the next question to you, which is, who will be able to participate on the Data Stewardship Collaborative?
So the collaborative right now does have members from all of the provinces and territories and some areas of the federal government. So this includes Health Canada, Statistics Canada, Indigenous Services Canada, Public Health Agency of Canada, as well as Canada Health Infoway. So that's sort of the core membership for that group. I think, as I mentioned before, when kind of describing the overall governance structure, there'll be opportunities to gather different perspectives and voices through some of those other tables. So depending on the topic at hand, if you think about the task and finish groups, we would expect to be able to invite and access subject matter experts to tackle specific stewardship challenges. But also the multi-interest advisory panel is really going to be key. So this is where we're looking for that wide perspective with different types of stakeholders and partners from across the system who may not necessarily be at that collaborative table itself. And maybe I just mention as well that a key function of CIHI in taking on this role as the strategic coordinating center is that we're in the process right now of evolving and learning as we grow to really build up that sensing function so that we do have inputs into this governance model from voices that may traditionally not have had quite as much access, because this is something that we did hear when we were engaging with our various stakeholders, is that we do need more meaningful engagement from some other types of groups, such as patients, such as the public. So that's something that we're definitely taking to heart and looking to incorporate as we build up these groups in the next couple of months.
All right, and I'm just going to add, there was actually more of a comment in here rather than a question, but I do want, it's really important, so I do want to highlight it, which is, can I make a suggestion for the glossary? Stakeholder is a common corporate term for partners, which has negative connotations to many Indigenous people. And when land acquisition was happening, the term referred to the allotment of land to settlers. And settlers, I didn't actually know this, but settlers. Sorry, I just need to move my. Settlers were given wooden stakes to claim their plot of land prior to any treaty or land negotiations with Indigenous people. It's more appropriate to refer to Indigenous people as partners rather than stakeholders. Indigenous peoples are not stakeholders, they're Aboriginal rights holders whose rights are protected under the Constitution of Canada. I would absolutely agree with that, and we do think about our Indigenous partners as rights holders, and as part of this work, we also recognize that we have to work in partnership with a lot of Indigenous data governance, including the First Nations Information Governance Centre, who are leading Indigenous data governance for themselves, and how we can support that work and be an ally to all of the existing work that is happening on the Indigenous data governance and sovereignty front. So definitely recognize the language is very, very important there in terms of how we're talking about the people we are working with. Okay, so our next question is, agree that the legislative inconsistencies are, oh, sorry, just my mouse switched, is a major barrier to data sharing. Sometimes they seem like artificial, unnecessary bureaucracy. Is there any documented harm associated with health data sharing across and within Canadian provinces? I can maybe take this one. I would say it's pretty tricky to measure. If people aren't aware, one of the things a group called Network Health has come up with, which is a data-related harm framework, which kind of highlights some of the harm that comes from using data and also not using data. And I think one of the challenges that we have sometimes had is the harm that's related to not using data, whether that's sharing data for patient care, or where we've had missed opportunities because we're missing out on research and innovation opportunities because we're not sharing the data or maximizing its use. That's a bit tricky to actually measure, but I think there is work underway to try and get a bit more of a handle on what the implications are. And I think then knowing that harm is actually happening, I think, is one of the key drivers for some of the work that we're trying to do here. Is kind of, we know that we're, at small levels and at macro levels, we're missing these opportunities to maximize the use of the data, but doing so in safe and transparent ways so that we make the most of it. And I think, again, trying to break down some of that bureaucracy in terms of making it more efficient, either through streamlining processes, having similar tools and processes so we're not reinventing the wheel. All of those types of things are hopefully outcomes of this data stewardship work. I'm just going to pause in case Toby or Jesse want to add anything.
I might just add quickly that I think in our engagements, particularly with patients and the public, I think there's a sense that we're already doing much more data sharing than we actually are. So this narrative that, there are potentially risks associated with it, but I think on the flip side, they're much more champions of interpreting things such that it allows the data to be shared for public benefit. So I think that is just something that we've realized in all of the stakeholder engagement that we've done. It sort of speaks to maybe a little bit of a disconnect from the narrative that tends to be the priority one.
Yeah. The next one is more of a comment, which is, I hope that health data use for research supports open science as well. And I absolutely agree with you. I think that's an intent. I think one of the challenges we have is the openness and transparency around our health data. And I think that will help support better use and hopefully that kind of open science approach as we go forward. Okay, next question. How does this apply to smaller organizations with limited resources? Maybe Jesse?
Sure, thanks. Great question. The framework really, it's designed to be flexible and scalable. So it's not about building something entirely new. It's really about strengthening what already exists. So organizations can start small, they can focus on priority components and use the self-assessment tool, which is scheduled for release in early April, to sort of identify practical incremental improvements. So I had mentioned earlier that the idea is that the users of the framework, whether they're big jurisdictions or small organizations, they're able to really work towards implementing aspects of the framework however they can within initiatives already underway. We want to stress that stewardship really is a journey and it's not something that's kind of all or nothing implementation. So size-wise, we're hoping that the way the framework is set up and the tools that we are creating through the implementation hub will really help jumpstart your stewardship journeys. Toby or Maureen, is there anything else you wanted to add to that?
No, I think that's good. A question from around terminology standards. And maybe I'll take this one, which is some terminology standards in use US-centric formal code systems. How do we plan to address this challenge, these challenges across different purposes, i.e. analytical data versus direct care? This can make direct data representation and interpretation challenging. Will this be looked at in data stewardship or another area, or is this something we can add to the list? I think we can definitely add it to the challenge list. I'm not exactly sure if it's directly related in there directly, but I do think one of our sister initiatives, which is our Connected Care initiative, which is really focused on the data content standards and trying to set some more national standards around the data content. I think is kind of where a lot of the development work around that data content and the representation of data and what we need for Canada is going to be there. And I would absolutely agree. I think one of the challenges, we want to leverage international standards, but sometimes they, especially with HL7, for example, which has been kind of predominantly developed in the States, is a challenge. So we are looking at some of those things through that initiative, and I think we'll continue to evolve in terms of how can we adapt international standards for use in Canada as we continue to move forward. And I think the governance of those standards and that content is something that the Data Stewardship Initiative will be supporting as we continue to move forward. Okay, next question. Has there been any consideration to have First Nations, Inuit and Métis representation on the collaborative beyond Indigenous Services Canada? So maybe I'll pass that one over to Toby.
So yes, short answer, yes, absolutely. So I should mention that to start, we have our Director of Indigenous Health at CIHI, Garanahawe Macomber, who's going to be part of that table. And she's currently working on more of a all CIHI strategy in terms of her engagement with First Nations, Inuit, and Métis, recognizing that there's often limited capacity, limited individuals, or the same people that are being, engaged with on a number of different topics. So she's sort of our first point of contact, but absolutely we want their representation both on the collaborative and on the multi-interest advisory panel, perhaps even on the task and finish groups if there's a particular stewardship challenge that relates to kind of First Nations, Inuit, and Métis stewardship issues. So yes, it's a work in progress, but for sure.
And I'd also add, as part of the work that CIHI is doing in partnership with First Nations, Inuit and Métis, there are other bodies that Garanahawe is connected to so we can also right now she's going to be our conduit into some of those initiatives and work that are who are leading their own First Nations, Inuit, and Métis data governance work so that we can connect the dots as we go. So it is a really important part. And as I said, we want to be an ally and we need to make sure that those perspectives are front and center in the work that we do. But we're kind of in the early stages of building up those relationships. So that piece, I think, will evolve and grow as we continue to move forward. All right. Our next question is, how is data communication and sharing being protected against AI technology intervening in the conversation? I'm not entirely sure exactly what that question relates to, but maybe if there's a question around just how data stewardship and AI are connected, I don't know, maybe Jessie, I'll throw it to you first and then maybe Toby.
Sure. So the way I kind of see it is this stewardship framework provides sort of that the guardrails to support the responsible and sort of ethical adoption and use of AI technologies. So it lays that like strategic foundation to really harness AIs in ways that are ethical, that are transparent and grounded in public trust, specifically through some of our components like the guiding principles and culture component, the stewardship skills and literacy component, the data use component as well. And then kind of in addition to that, the governance model really provides that sort of consistency. So ensuring that transparency, that accountability, and the sort of like consistent evaluation of risks and benefits to really like help safeguard public trust around AI technologies and the adoption of AI technologies. So I think together those two aspects of the initiative really help ensure that AI is sort of developed and safely used in ways that really respects the diverse needs and sort of works to avoid reinforcing inequities and things like that. Toby, anything you wanted to add on that one?
Yeah, I maybe would just quickly add the stewardship piece is more focused on sort of the precursors to being able to effectively use AI, things like data quality and building that common understanding that you sort of need to have those building blocks in place to be able to deploy those exciting, innovative technologies, right? So it's about making having those discussions and sort of laying that foundation collectively and in an aligned way.
Yeah, I would absolutely agree. Just to add my 2 cents to this, I think it amps up the importance of it. There's so much interest in kind of really leaping ahead with AI. And I think if we don't get some of this foundational stewardship aspects of the actual data itself right, we often hear about garbage in, garbage out. I think it will only be completely amplified with some of these AI tools if we don't do some of this basic stuff in the right way as we continue to move forward. I know there's a couple of other questions in the thing, but so I've got one last one, which is about data linkage, and it's there's a challenge with data linkage beyond a point where an actor, data steward, leaves the circle of care. How do you suggest addressing that challenge? What's being done to make data linkage possible, and what can individual organizations do to facilitate data linkage and flow? Have you got? I can maybe throw my 2 cents in, unless Toby, Jesse, you want.
I think it's all about interoperability and standards is kind of the foundation for that, right? So I would say things like that are in progress right now, like the Pan-Canadian Health Data Content Framework standards, adoption of those, and having everybody kind of use those same standards will go a long way to facilitating and enabling the type of data linkages or just the interoperability of data that will allow us to do a lot more than we are now. So that's just one short answer. And the intent of sort of the stewardship collaborative and things like that is to sort of have a discussion about how do we go about sort of promoting that type of consistent adoption of standards across the country. So that's within the scope of what we're trying to do for sure.
Yeah, and I think there's aspects of data linkages kind of from a patient care perspective versus what you can do analytically after the fact for doing some of the kind of longitudinal analysis of outcomes and things like that. So the needs of what that type of data linkages are may be a little different than what you need to do when you're doing kind of data linkage for patient records, patient care. And so some of that we'll need to work through. I think there are some guidance and more consistency in approaches. And I think the other piece of this, which kind of got mentioned too, is the risk related to and how we think about the risk around when we link data. It's often seen as very risky. And therefore people don't want to do it. But I think managing that risk is kind of, and how we approach assessing and doing that risk benefit analysis is something that I think we will continue to develop and work through to help people make good decisions about the data as we move forward. So unfortunately, we're almost out of time. So I know there were a few questions in there that we didn't get to. So I apologize that we weren't able to get the questions. There was a question in there about sharing the decks, and I think that we will be able to share the information and the recording afterwards. So just a reminder, the information, all of the details around the health data stewardship framework itself, the governance structure, the hallmarks of data stewardship are available on CIHI. For those who weren't in attendance, we also had our first webinar on December 9th, which was a great overview with our CEO and some other key people around kind of the importance of data stewardship. So definitely, if you have time, go and listen and watch that webinar. And stay tuned for future data stewardship webinars. And if you have any questions, further comments, ideas of what would be really helpful to you as you are working on data stewardship within your own organization, please send us an email at datastewardship@cihi.ca. We would love to hear from you and talk to you. So thank you very much for spending an hour with us this afternoon, and look forward to working with you in the future. So thanks, everybody.